Hello, everyone. Welcome to LUMP, TCM, and Acupuncture Basics. Let's start with the first presentation, Deficiency States. Example, lung indeficiency. So when you have lung indeficiency, you will have dry skin, dry nose, or throat. Of course, if there is deficiency, we tonify the lung indeficiency directly with the front viewpoint of the lung, which is lung 1, and the tonification point, lung 9. Both points should be used together. So both front view and tonification point, as one increases the quantity and the other improves the quality. Lung 9 tonifies yin and yang. As the lung is an organ, it tonifies more of the yin and less of the yang. So ratio of 90-10. Next, we have lung-yang deficiency. If you have lung-yang deficiency, you have chronic black nose, cannot sweat, chronic asthma in wet, cold weather. In this case, lung 9 is unsuitable because if we use lung 9, it will increase more of the yin. So when lung yang is deficient, the large intestine, which had a normal amount of yang, will try to fill this deficiency. So over a period of time, if the large intestine yang will try to fill this deficiency, then in the long run, the large intestine yang will become deficient. And if lung yang is now deficient, this is because the large intestine yang is at the same level as the lung and is therefore unable to supply any more yang to the lung. So treatment, Li11 tonifies more of the yang, so ratio of 90-10. When the large intestine receives more energy, it will automatically flow to the lung. Okay, it will stop flowing into the lung when they both have the same quantity of yang. This is direct tonification of Li yang and indirect tonification of lung yang. Another example, when you have functional yang or functional qi deficiency of the urinary bladder. So symptoms, problems starting and ending urination, controlling urination, and emptying the bladder. So we tonify bladder 67 plus the tonification point. So there would be quantitative increase in energy. So it increases the yang of the urinary bladder at the ratio of 90-10. Then we use the bakshu of the urinary bladder, which is bladder 28, to improve the function. Okay, so we increase the energy quantitatively and we also improve the function using the bakshu. Thank you very much for your attention. Let's now have the second presentation. Let's welcome Sir Dino of Legazpi. He will continue discussing the miscellaneous pathogenic factors. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Now we continue with miscellaneous pathogenic factor. First, we have the excessive alcohol. Here again, moderation is the key word. Spirit increase more liver fire heat. Wines cause wind heat in the liver, and beer with its high calories cause more dampness in spleen. All alcohol creates damp heat in the stomach and consumes the function of qi. Alcohol increases liver fire heat and consumes liver yin. The liver yin is unable to hold blood within the vessels, causing spontaneous and excessive bleeding. Example, we have the liver cirrhosis. The patient suffers tension, There's tremor, loss of control when angry, and other liver yin deficiency symptoms. Sa treatment, we use liver 5, which is the Viewpoint, GB40, the U1 source point sedation. Only when patient has many heat symptoms or if vomiting blood, local points on REN meridian, we use REN 12, REN 14, and REN 17. Next, alcohol causes damp heat in the stomach and consumes spleen qi. This causes edema in the face and extremities. There's poor digestion, lethargy, and alcohol dependence. The peripheral blood and nutritional circulation slow down, causing polyneuropathy or poor wound healing. Sa treatment, we use REN 12, MOXA if patient is not vomiting blood, UB20, UB21, stomach 40, stomach 36, and TC6. Sa overwork naman, excessive physical work exhausts the kidney yin. Excessive mental work exhausts the heart, blood, and yin. It also means that we do not rest enough to build up this yin or blood in the period of excessive work. This could lead to a burnout with the yin and blood severely consumed and the person unable to go on working, causing a qi deficiency. Instead of working long hours every day and living for a holiday, one should work and rest and eat and play proportionately each day. The body cannot be expected to work on future promises. It is not a car in which we could keep going until the engine stops due to running out of petrol and then start again after simply refueling. Even a car does not like being without fuel, and body cannot certainly work in this way. Sa points natin to tonify heart blood, we use REN 14, UB15, the Mu and Shu points. PC6, the distal points. UB17, influential point for blood. GB39, influential point for marrow. DU20, liver 3, for general well-being and for sleepless and nervousness. Points to tonify kidney yin, we use kidney 7, the tonification point. UB40, the grandmother point, tonifies yin. REN 3, the Mu point of UB. Spleen 6, the distal point for lower warmer. Spend some time in water, swimming, bathing, and drink water. Thank you po for your attention.
Thank you very much, Sir Dino. Let's continue with a new topic, needling techniques. In effective acupuncture treatment, making the correct energy diagnosis is half the battle won. This will ensure an appropriate effort to bring about balance, but it is only half the effort. The rest of the success of the treatment depends on choosing the best points, the correct needling maneuvers, and the necessary extraordinary therapies to carry out the therapy. The better we master these techniques, the more effective our single treatments will become. It is therefore worth spending some time and energy to learn about this. Acupuncture is a doing medicine. No matter how eloquent our choice of words and the explanations of the symptoms and illnesses of the patients, it is finally what we do with our needles on the patient that works. Patients cooperate by making changes to their diet and lifestyle according to the energy balance we're trying to achieve. We have to give clear messages to the body with our needles, the manipulation of these needles, the choice of points to needle, and selection of extraordinary therapies such as moxibustion, cupping, electrical stimulation of needles, and plum blossom needle tapping therapy. If our message is clear, the energy flow will change accordingly. If the message is not clear, or if we try to achieve too many changes within a short time, the energy flow will be confused and scattered. Okay, according to the author, one of his colleagues phoned him on several occasions to consult about the problem patients. Once she called to ask about a particularly difficult case. So after listening to the problem, the author responded, "This seems to be a problem patient. Maybe you should sedate liver too." Then the one who was asking for help was answered, "I have already done that." Or maybe it was a deficiency. You could try tonifying liver 8. Okay, then she answered, "I have done that as well." "What do you mean? Did you tonify or sedate the liver?" "I did both at the same time. I thought one of them should work." Okay, so this is what the author meant by saying that we should give clear messages to the body. If you tonify and sedate an organ at the same time, what do you expect to happen? To which command should the body comply? The next thing to remember is not to stimulate many energy balancing points in the same treatment. It is not as we are setting up a circuit of events that would start occurring one after another soon after the first needle. We are changing something more deep and fundamental in the body energy, and this has to be done gradually and steadily, achieving little and maintaining that improvement, then achieving more on top of that one by one. Many practitioners try to do this by partly using needles and partly using herbal medicine. So the author mainly uses acupuncture, and some dietary and lifestyle changes were pertinent. After all, both herbal medicine and diet influence the deeper energies of the body. Now let us take a look at the various needling techniques. Okay, so choice of needle. So it's between thin needles and thick needles. So thin needles are used for thin-skinned areas like the face, hands, and feet. Thin needles are used for tonification. They are used for cosmetic treatments and skin ailments like acne, cellulite, wart, psoriasis at local areas. Thick needles, on the other hand, are used for thick-skinned areas like the body, the arms, and legs, used for sedation technique. Thick needles with metal handles are used in extraordinary therapies like moxa. So hot needle, when a piece of moxa is attached to the handle of the needle and burned. Okay, so when you do EA, electrical stimulation of the needle, so the needle should be thick, and in paralysis as a local treatment. Thank you very much for your attention. Let's call on Sir Dino once again for the 5 elements. Good afternoon ulit, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Now we go to the earth element, the concept. Okay, we have the yin dominant state and the yang dominant state. Stomach receives and digests food and drink. Spleen absorbs and distributes nutrients. Spleen nourishes muscles and fat. Spleen circulates blood and fluid. Spleen tones connective tissue. Spleen and stomach opens to the mouth and lips. Spleen secretes saliva, sensitive on earth element. In taste, flavor niya is sweet. Associated emotion is worry. Energy-giving color is yellow. The climate is damp. And yung coupled organ is stomach. Stomach receives and digests food and drinks. What we put in our mouth first enters the stomach. Stomach digests this food and drink, ready for the spleen to absorb the purer nutrients and send them ahead for nourishing blood. Hunger, appetite, and thirst are associated with the stomach. Let us take a closer look at this. Before we feel hungry, it is necessary to have an empty stomach. This is not only to literally feel the emptiness of the stomach, but also have symptoms of low blood sugar, or hypoglycemia. To feel weak, shaky, or even get a headache. As the yin decreases, the yang tends to rise. This is the growling, burning with acidity, and even a anger that is hunger. So how often one feels hungry and how long one can tolerate hunger depends on the activity of the stomach. If the stomach has activity, the chi is too rapid, then it will empty very quickly. So kung malakas po yung activity ng stomach, mabilis din mawala yung laman, leaving the person feeling frequently hungry. If the function is slow, the emptying time is long. So kung mahina naman yung function, matagal din ma-empty. One seldom feels hungry and feels full for a long time after consuming food. So stomach yang rising with yin deficiency, feel hungry often, and quick emptying. Yung isa naman, stomach chi deficiency with fullness, slow emptying, feel full for a long time after eating. How much food one needs to eat to feel satisfied is different for different people. Some people feel quite satisfied after eating little quantities, whereas some others can eat a lot and continuously without feeling content. A major part of the stomach wall is made up of muscles. As the food enters the stomach, the peristaltic movement of the muscle wall begins, thus making the stomach smaller and more compact. When the stomach feels comfortably full, we stop eating. But if the tone of the stomach muscle is poor, it will lead to passive expansion, and one can continue to eat. Such a person does not feel satisfied with the quantity of food he or she eating. However, as the function of the stomach is also poor, the emptying is delayed and they feel full and uncomfortable for a long time after eating. Thank you po for listening.
Thank you very much, Sir Dino. Next, we discuss the 8 principles. Okay, differentiation of patterns using the 8 principles is considered the basis for all other methods of pattern identification in TCM. It can be applied to almost all cases as opposed to other methods of patterns of identification. So the 4 paired characteristics of the 8 principles are, first you need to determine if the condition is yin or more of yang. So this is about overall quality of the disease. Next, interior or exterior, to determine the location of the disease. Deficiency or excess, to determine relative strength of the disease. And cold or heat, for the nature of the disease. So what are the signs and symptoms manifesting? So as you can see on the figure, if we concentrate on the yang, this would almost mean that it's exterior, excess, and heat. So if you say exterior, it actually is involving the skin, the hair, the flesh, and the meridians, as contracted to the interior, okay, involving a deeper location, like the organs, bone marrow, chi, and blood. Okay, so if it is if it's excess, that means the disease-preventing forces are not present, and there is increase or presence of pathogenic factors. For a deficiency condition, the disease-preventing forces are diminished. So that means the patient has has already a pre-existing issue or a comorbidity. Okay, and there are no pathogenic factors. With heat, so it's like between yin deficiency or empty heat, cold, yang deficiency or excess cold. Okay, now let's define the aspects of the 8 principles. Okay. Yang is unsubstantial energy, the physiological energy that moves, warms, and transforms, while yin is substantial. So being substantial, it nourishes, moistens, and that has more structure. Exterior is referring to the space between the skin and muscles, where the wei qi and sweats are located and first invaded by external pernicious influence or the external pathogenic factor. Interior, internal organs are affected. Excess, presence of pathogenic factor, while the upright qi is relatively strong. Deficiency or empty of, so this is actually referring to the upright qi that is very deficient and the absence of pathogenic factor. So kahit walang pathogenic factor, you still get sick. Okay, so full heat arises from yang excess, while empty heat arises from yin deficiency. Full cold arises from yin excess, empty cold arises from yang deficiency. A patient's condition can be deficient, cold, and or interior. It could also be a combination of any of these principles. For example, a person can have an interior deficient condition complicated with an excess condition. So a very common situation or very common case in the clinic would be chronic spleen deficiency that has led to accumulation of dampness. And we all know that dampness is an excess condition. Therefore, in theory, we can further categorize the 8 principles as follows. So, yin includes interior, deficient, and cold. Yang includes exterior, excess, and heat. So it could be deficient yin or yang, or collapse of yin or yang. Interior or exterior. Exterior gone interior, or interior gone exterior. Then cold-heat combination, cold on the extremities, heat on the interior. Heat on the extremities, cold on the interior. Heat above, cold below, or cold above, heat below. True cold, false heat, or true heat, false cold. Then we have deficiency excess, deficiency of qi, yang, shui, or blood, and or yin. Relationship between exterior and interior. So transmission from exterior to interior. This is where diseases get worse. So wei qi is weak and the pathogenic factor is stronger. Okay, so if you have a situation in which an exterior condition becomes an interior, that means it could be a wrong treatment. That means you're worsening the imbalance. Okay, another would be transmission from interior to exterior. That means the disease gets better. And the wei qi was triumphant in pushing out the pathogenic factor. So that means you're doing the right treatment because you're pushing out the pathogen. Exterior and interior at the same time. So exterior evil invading the exterior and interior at the same time. External evil, rather. Patient with chronic disease suffering from a new disease. Now let's go to the intermediate syndrome between exterior and interior, the Shaoyang stage. So the EPI, the external pathogenic, external pernicious influence fails to be transmitted completely to the interior, while the wei qi is not strong enough to expel it to the surface. So the evil is between the exterior and interior. So the key signs and symptoms here would be strong, alternating chills and fever. Thank you so much for listening. Let us now proceed to the Zangfu organs, and let's welcome from Quezon City, Ma'am Lynn Galarita. Good afternoon, Ma'am Lynn.
Good afternoon, Doc. Good afternoon, everybody. Still on the Zangfu organs, after we discussed on functions, let's go to lung relationships. The relationship between the lungs and the heart. Heart governs the blood, lung governs the qi. Blood of the heart nourishes the lungs. Lung qi warms the heart and supports it in production and circulation of the blood. The relationship between heart and lungs corresponds to the relationship between qi and blood. Thus, disturbance of the heart can result in disturbance of the lungs and vice versa. Now let's move on to the relationship between lungs and the liver. Lungs govern qi, as liver is responsible for harmonious flow of qi. If liver qi stagnates, it affects the down-bearing function of lung qi. Lung qi can accumulate in the thorax and cause stagnation. Liver requires lung qi to regulate the blood. Lungs stand in interior-exterior relationship with the large intestine. The down-bearing function of lungs is needed by the large intestine in order to convey and transform waste. Thus, if lung qi or lung is deficient, then we can expect disorders in the large intestine. Functionally, large intestine has a closer relationship to the digestive tract and its organs, namely the spleen, the stomach, and the small intestine. Now let's move on to the relationship between the lungs and the spleen. Spleen transforms ingested food into food qi. Food qi is then sent to the lungs, and after that, gathering qi is produced in the lungs by transforming food qi and the inhaled air. True qi is produced in the lungs by transformation of the gathering qi and under the influence of the original yuan qi, as shown in the diagram below. Thus, the quality of true qi depends on the food qi and the spleen function. So it depends on the quality of the food that we ingest and the health of our spleen. So if spleen function is impaired, dampness is then produced. Dampness is sent to the lungs where it accumulates. Spleen is the producer of dampness, while lung storage for dampness. Spleen depends on lung qi to fulfill its function of transformation and transportation. Now for the relationship between the lungs and the kidneys. Lungs govern qi as kidneys are the root of qi. Lungs regulate waterways and aid kidneys to govern water. Kidneys ensure absorption of qi through the lungs. Thus, if kidney yang is deficient, the ability to absorb qi is impaired and qi stagnates in the lungs. If lungs are too weak to fulfill its function of down-bearing the qi, kidneys are affected. Thus, kidney yang supports the lungs in the qi production. We have discussed this earlier. So now let's start our discussion on lung pathology. There are two types of patterns generally in lung pathology: deficiency patterns and excess patterns. For deficiency patterns, we have lung qi deficiency, lung yin deficiency, and for excess patterns, we have stagnation of lung qi, weak hind in lungs, wind cold in lungs, dryness in lungs, phlegm cold in lungs, and phlegm heat in lungs. That's all for now. Thank you for listening.
Thank you very much, Ma'am Lynn, for that very wonderful introduction to lung pathology. Let's now continue with Meridian Theory, and let's call once again Sir Dino from Legazpi.
Good afternoon, Doc. Good afternoon po sa lahat. Now we continue with the urinary bladder meridian of the foot great yang part 2. First, we have the UB14, which is located 1.5 June lateral to the posterior midline on the level of the lower border of the spinous process of the fourth thoracic vertebra, or the T4. So point explanation, we have the back shoe point of the pericardium. Next point is UB15, which is located 1.5 June lateral to the posterior midline on the level of the lower border of the spinous process of the fifth thoracic vertebra, or the T5. Sa point explanation, we have the back shoe point of the heart. It is used to improve the heart function, the speed, circulation, concentration, and state of alertness. Next point, we have the UB17, which is located 1.5 June lateral to the posterior midline on the level of the lower border of the spinous process of the seventh thoracic vertebra, or the T7. T7 can be localized with the shoulder hanging at the level of the lower tips of the scapula. Sa point explanation, the influential point of blood, it treats all blood disorder such as allergies, anemia, leukemia. It is also the back shoe point of the diaphragm and can be used for hiccup and hiatus hernia. Next point, we have UB18, which is located 1.5 June lateral to the posterior midline on the level of the lower border of the spinous process of the ninth thoracic vertebra. Point explanation, this is the back shoe point of the liver, influences the liver function, and effective point for improving sight, to increase blood pressure, to help digest milk products, and to treat suppressed aggression. Next point, we have the UB19, which is located 1.5 June, lateral to the posterior midline on the level of the lower border of the spinous process of the 10th thoracic vertebra, or T10. This is the back shoe point of the gallbladder. It is used for improving the emptying function of the gallbladder and in the treatment of the upper abdominal distension. Next point, we have the UB20, which is located 1.5 June lateral to the posterior midline on the level of the lower border of the spinous process of the 11th thoracic vertebra, or T11. This is the back shoe point of the spleen. It is an excellent point for circulation of thick fluids around the body, especially in the hands, feet, and face. It is also helps firm the connective tissue improves absorption of nutrition, and ensures to deep in energy after meals. Next point, we have the UB21, which is located 1.5 June lateral to the posterior midline on the level of the lower border of the spinous process, the 12 thoracic vertebra, or T12. This is the back shoe point of the stomach, will improve the emptying function of the stomach and make it contract better on receiving food. This is a very important function for us to feel satisfied when eating and know when to stop. As the stomach contracts, the feeling of satisfaction is reached at an earlier point. When the stomach muscles are too flaccid, it just stretches and enlarges like a deflated balloon, and the appetite will never be satisfied. So here is the diagram of the urinary bladder points. Sundan na lang po natin. Thank you po for your attention.
Thank you very much, Sir Dino. We now come to the last presentation for today. We will continue with chest painful obstruction syndrome, and this time we talk about the pathology. From a Chinese viewpoint, the heart is central to the condition of chest painful obstruction, but there are other organs like the lungs, stomach, liver, spleen, and kidneys that play a prominent role. The lungs govern gathering qi, or the zong qi, of the chest. This assists the heart in pushing blood through the blood vessels. If gathering qi is weak, the heart will lack force to pump, and the blood stagnates in the chest. The spiritual axis in chapter 75 says, if gathering qi does not descend, blood will stagnate in the vessels. So it is very important to move the qi to invigorate blood. And so we have Ren 17, where the gathering qi collects as a very important point to move qi in the chest to relieve blood stasis. Stomach also affects the heart and blood circulation. The great connecting channel of the stomach gives the pulse the force to contract and dilate. This channel emerges from the stomach and goes to the area below the left breast. The pulsation that can be felt here, called shuli, is the pulsation of the great connecting channel of the stomach. Hence, the importance of treating the stomach to support the heart and help to invigorate blood. Stomach 40, for example, is extremely important to open the chest and improve the circulation of blood there. Stomach 36 is very important to regulate the pulse and should always be needled when the pulse is irregular. Food retention in the stomach also affects development of chest painful obstruction. When food stagnates in the middle burner, it obstructs qi and blood circulation in the chest and prevents heart qi and lung qi from descending. Liver influences the pathology of chest painful obstruction syndrome through qi stagnation. Qi stagnation is usually the first pathogenic factor giving rise to CPOS, or chest painful obstruction syndrome, causing feeling of distension in the chest. Spleen influences pathology of CPOS primarily through the phlegm. When spleen qi or spleen yang is deficient, fluids are not transformed properly and may accumulate in the form of phlegm. So the phlegm settles in the chest and causes obstruction of the channels and blood vessels there. And so there is a feeling of oppression of the chest. From a modern perspective, raised cholesterol is often considered a form of phlegm. Kidneys play an important role in the pathology of CPOS. Heart and kidneys need to communicate with and nourish each other. Kidney yang deficiency often affects the heart by leading to internal cold, and this affects blood vessels of the chest. Chest painful obstruction is always characterized by combination of deficiency and excess. Root of the disease is deficiency of spleen, heart, or kidneys, or a combination of these. Manifestation is characterized by stasis of blood, cold, or phlegm. So here we are, we see a flow chart of the root and manifestation of chest painful obstruction. So root and manifestation. So let's talk about if you have deficient spleen yang and kidney yang, this means fluids cannot be transformed and there is inability to warm, so giving rise to internal cold. So this will be manifested as phlegm, and the phlegm will lead to blood stasis. Now, if you have heart yang deficiency, this also cannot warm, so they gives rise to internal cold. So that means there is lack of communication between the heart and kidney. So heart yang deficiency cannot move blood, and so leading to blood stasis. So this is the root and manifestation of chest painful obstruction. Thank you all very much for your attention, and we hope to see you in our next presentation. Thank you, everyone.